The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
We rarely think about the air that we breathe because it's so common, it's so ever-present, but the lungs and the respiratory tree represent to the body the same kind of thing that the Holy Spirit and our communion with the Holy Spirit represent to the soul. In this program, we'll be studying about the lungs and how you can take care of them and how you can learn how they're functioning.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
There are many ways that we can test how the lungs are functioning. We can do x-rays, we can do CT scans. There are many very sophisticated surgical procedures such as washings of the bronchi and bronchoscopy. All of these can help us to know about the functioning of the lungs. But there are some very good ways that in the home you can do some functional tests that may tell you as much as a doctor can learn with a stethoscope or with some of the very sophisticated things that we can do by listening to the lungs or by tapping on the chest or by feeling of the way that the lungs feel when you breathe or when you talk. These things a doctor can do, but you can do many things right in your own home. I'd like to show you first a graphic that will help you to see the construction of the lungs and just where they are located in the chest. You will see here that the diaphragm is rather high in the body. It comes up well above the waist, and the lungs dip down to the waist, and in some instances actually a little below the waist on the sides only, but in the central part they're really quite high up. Then the upper portions of the lung reach all the way up to the shoulders, just to the very top of the body almost. And notice the bronchi and the trachea. These are those organs that get sick and that get irritated when a person has a cough. Now, if you have pneumonia or what we call lung disease, then the lungs themselves are involved. Notice that the right lung has 3 lobes, but the left lung has only 2 lobes. That's because of the presence of the heart in the left chest, which makes the left lung not have enough room to have 3 lobes. When we have disease, we often have it in just 1 lobe of the lungs. Such may be the case with pneumonia, that we may have it only in 1 lobe. So you can see how we can just have 1 lobe involved with, let's say, tuberculosis. Or we could have 1 lung involved with a disease called bronchiectasis. And I will be talking about some of these disorders, but you will also recognize that the entire bronchial tree or the entire lungs may be involved in something like whooping cough, and we'll be talking about that as well. So having seen this graphic, then you understand about where the lungs are located, where you should tap or where you should apply some application of some kind like a heating compress or some kind of hydrotherapy. You can see just where the lungs are located, and that can help you to know how you can treat the lungs. Now, there are several little tests that we can do to determine the effectiveness of the lungs and how they're working, and whether some chronic disease that we have may be a problem here. And one of these is the match test. And Cheryl Shears and Danny Blackburn will show you how to do this test. It's a very simple test, and I'm sure you will see does not require a lot of sophisticated equipment, but does give a lot of information. Cheryl, how are you going to do this test?
Well, you need a 6-inch ruler, And your subject will be holding the ruler beside her mouth, and I'm going to light a match and put it 6 inches from her mouth, and she will take a deep breath, as deep as she possibly can, and then with all the strength that she has to blow this match out with her mouth wide open. There needs to be no constriction of the throat or the mouth. So are you ready? Let's try it again. Pretty good.
All right, Danique passes. And sometimes the subject will not pass the first test. And maybe they direct the air in the wrong way, or in some other way they don't do the test exactly accurately. So it's all right to give them a second trial. Then there is another test that we can use to test the functional capacity of the lungs, and this is the forced expiratory rate. And Cheryl is going to show about how to do that one as well.
With this test, again, Danique will take a full, deep breath of air, and she will blow it out, and I will be timing her from the time that she begins to exhale to the last bit of air that comes out. Are you ready? Okay. Take a deep breath. Begin. 2 seconds. Very good. 2 to 5 seconds is normal. If you have 6 seconds or more, that's suggestive of pulmonary disease.
Mm-hmm. In fact, the pulmonary diseases can be narrowed down to 2 different ones, restrictive and obstructive. If the person does not have a good test on either one of these, that means that they have something wrong with either obstruction or restriction. Now, I'm sure that with a little bit of nervousness, a person might have some restrictive chest disease, such as might come from tight muscles, and that might make a failure on the match test. And then obstructive disease is some kind of obstruction. It could be a cancer, it could be a scar, it could be swollen lymph nodes, it could be a place where there is some disease such as tuberculosis. And so if either one of these tests is a positive test, then the person needs to have some professional help. Another affliction of the lungs is what we call cystic fibrosis. While it involves other organs as well as the lungs are often a very prominent part of this disease. Since people with cystic fibrosis often excrete excessive quantities of sodium on the skin, this disease can usually be detected by simply seeing if the person has excessive sodium on the skin. Mothers can easily do this test for their children. When they kiss the child, they just open the mouth and touch the tongue to the skin of the face. And usually they will be able to tell if the child has excessive salt on the skin. They can find it on the arm or the back also. Now, for some people, there are kinds of chest disease that we need to give them a treatment that involves putting them on a slant. And Cheryl is going to show you now, with Danique as the patient, how to do this very simple treatment for a patient.
We have just used a simple chair and turned it upside down and put a pillow and a blanket on it. And Danique is going to climb up here and lay over it so that she is slanted downward from her waist. And then the simple procedure is just to tap lightly on the back, like this.
Often the person is then able to cough up a great deal of mucus and secretions, and with this very simple thing, they may, after 15 or 20 minutes, have entirely clear lungs. So it's a very simple thing to do, and is often done by a patient all by himself, but if the person has a helper, of course that can be a great deal better. Now I'd like to discuss some damaged lungs and how the damaged lung may cause a variety of problems with the lungs. The first one is that of bronchiectasis. Now, bronchiectasis is a dilation of bronchi in the terminal portions of the bronchi, so that there are little zones where grape-like clusters of dilated bronchi occur. And since these are abnormal, then abnormal function would be expected. And the particular abnormal function that we expect with bronchiectasis is that of accumulation of secretions. Now, with accumulation of secretions, we can get infections, we can get pain, we can get pleurisy, or even adhesions formed. And so it's desirable to get rid of these accumulations of secretions. Postural drainage is very helpful in this regard. One of the things that can cause areas of bronchiectasis is that of pneumonia. Now, with pneumonia, you will need professional help with that. But since pneumonia often mimics some other diseases of the chest, sometimes the person in the home may wonder, do I have pneumonia, or is it just bronchitis or a bad cold or the flu? And there are some things that can help one to know whether it is pneumonia or whether it is something more serious or less serious. One of those features of pneumonia is that of fever. The person may have a rather high fever. Some forms of pneumonia can give some of the highest fevers that we get. Then the pulse rate goes up. It may be 110 or 120 even. The pulse tends to rise 10 points with every degree of rise in temperature. This can give you a nice little test, if you don't have a thermometer, to judge just how high your temperature may be. Then the person is often very sick. They may be just prostrate. When they get up out of bed, they feel faint, weak. They may lose their appetite, and of course they usually have a cough. If all of these things occur in the same patient at the same time, then you'll want to seek professional help on that. Now, another thing is that of whooping cough. Whooping cough is a disease of childhood, and it's characterized by a number of features that we can easily recognize, especially as the disease progresses. Now, we don't find whooping cough as commonly as we once did. Diseases tend to wax and wane in a population. Regardless of the presence or absence of immunizations, there is still a waxing and waning of disease. And many diseases that have no vaccinations for them still show this pattern of an up and down type of occurrence in the population. With whooping cough, the reduced incidence makes it so that many people don't suspect it when it is actually there. They have not heard of anyone's having it. It is highly contagious, and it's usually passed by mouth droplets from one child to another. The peak incidence of whooping cough is in the late summer, so this also helps us to know that it is whooping cough rather than a bad cold or the flu, which are less likely to occur in the late summer. The incubation period from the time the person is exposed to someone who has whooping cough until they come down with it is usually about 7 to 10 days. The first sign may not be cough. It may just be a little runny nose, or they may have a little a feeling of discomfort in the throat, like a sore throat, and the nose may become a little infected so that the mucus is yellowish or greenish. But then comes the other part. They begin to get a cough. and after about a week, the cough settles down to the whooping type of cough. This cough is with a cough and then with an inspiratory whoop or whoo, something like this. So they cough, and the force of the cough is very severe. Often the patient gives as much strength as they can to the cough, and then the whoop is also very characteristic and very distinctive. Because of the force of the cough, the child may actually vomit with the cough. One patient told me that she had 2 children with a whooping cough at one time. She had a paper bag lined with a plastic on one end of the bed and a paper bag with a plastic on the other end of the bed, so that if the oldest one coughed and was going to vomit, they went to the foot, and the other one, the youngest one, went to the head of the bed when they had the cough. This brings up another point. If at all possible, separate children in their own bedroom if you can. There will be less transfer of contagious diseases if each child has his own bedroom. Now, how can you treat the whooping cough? And treatment is very essential. Protect the child very nicely so that the child is less likely to develop some kind of complication like bronchiectasis, which is a chronic long-term disease which might even require surgery in order to cure it. So the first thing to do is get busy treating any disease immediately. As soon as you recognize there are symptoms, start treating, whether it's a child or whether it is an adult. Do not wait until the person is down with a disease or crippled from a disease before starting to treat the person, and you will get a much better effect from your treatments. Now, some of the fluids that we should push with whooping cough, one of them is catnip tea. The catnip tea can help to make the person not feel quite so uncomfortable. The way to make tea is very simple. Just take a cupful of water, put it in a pot such as this one, and bring it to a boil. Then take the tea, let's say this is catnip, and simply put a spoonful of the catnip tea leaves in a cup, and then pour the boiling water over the tea and stir it to wet all the leaves, and then let it steep for about 30 minutes, and you will have a tea that the person can enjoy. And catnip is not bad tasting tea, so you can enjoy the taste of catnip pretty well, and even children don't mind it too much. Catnip tends to have a soothing effect on coughs as well as on gastrointestinal problems. And people who have children who have colic, or people who are in some way anxious or nervous, these kinds of people may also have a need for catnip tea, can benefit from it very much. Then tepid baths are also very helpful for them. We may want to use a heating compress to the chest at night. This is done with a cloth on the chest covered with plastic, and then a wrap on the chest so that the plastic and the cold wet compress won't move. And this can be a very good treatment to help to reduce the number of times that the person coughs during the night. Hot baths can be used once in a while and can be helpful. They should not be used several times daily, except in very small infants when they're done for an exceedingly short length of time, like 2 or 3 minutes for a small child. But for older children, only once a day, and that can be helpful to clear up the infection. Then, of course, one should avoid exposure to all kinds of things. Should avoid exposure to other people, exposure to the elements, chilling in any way, getting too hot sweating a lot. All of these should be avoided as much as possible with whooping cough. Now there is another thing that we have that you can often diagnose in the home, and that is tuberculosis. If the person has ever had an exposure to someone who has tuberculosis, then they may feel that they might have TB. They can recognize symptoms such as anemia, weight loss, sallow complexion, night sweats, loss of appetite, and of course a cough. And the cough becomes productive. The productive nature of the cough is a part of what makes tuberculosis contagious, because the germ is spread from one person to another through the sputum. Now there is another disease that can easily be diagnosed at home, and that is asthma. Asthma is an important disease of childhood, and it's an important disease of adults as well. Many times when a child has asthma, they will grow out of it and not have asthma as adults. Sometimes a person with childhood asthma will just have asthma once in a while as an adult, maybe twice in their lifetime. When the person has asthma, there are two types of asthma. One is the acute attack, and the other is the maintenance or the long-term asthma, for which we do maintenance treatments. Now, with the acute attack, there is a nice little massage stroke that we can do, tapotement and cupping, and for that I'm going to need my assistants to help with that. And it's a very easy little procedure to do, and it does not require any special equipment, only the patient and the helper. And so now I would like to ask Cheryl Shears to demonstrate this procedure on Danique Blackburn.
You want to go and find just right below the scapula in this area, and then do a cupping, slapping like this to the back. Mm-hmm. And then you can do a tapotement, the fingertips.
Both of these stimulate the adrenals. Now you can recognize that the adrenals are located just above the kidneys. And that's why Cheryl went through the little thing of finding the shoulder blades and measuring down from that, because just below the shoulder blades, usually a couple of inches, you can position it pretty well by the bottom of the shoulder blades and the waist. About halfway in between that is where the upper part of the kidney is, and the adrenals sit right on top of that. That's where the adrenals get their name, adrenals, or next to the adrenals. So this treatment can be done in the acute asthmatic attack, which helps the individual to have a little extra adrenaline, and that and adrenaline opens up bronchi. Now for the person who has chronic asthma, that is, they have a long-term asthma, for these individuals we need to find those things that are causing the asthma. Now, asthma may be of two types, what we call intrinsic, that is something about the person inside, maybe some germ that grows with the person to which they have become allergic. This may cause the intrinsic type of asthma, or there may be some other internal feature that can cause intrinsic asthma. One of those is a food sensitivity. For people who are sensitive to foods, they may have their food set off by eating an orange, wheat and shellfish, and of course dairy products. I suspect that dairy products are probably the #1 cause of food sensitivity. So people who have asthma should test themselves with leaving off all dairy products, since about 60% of all sensitivities to foods are due to dairy products. So they can leave off the dairy products for a period of time and see if they don't get a lot better. Often dairy products are often implicated in earaches and repeated colds and sore throats in children. Now, external causes or airborne causes may be such things as animal dander and pollens or house dust. And an exposure to animals in the morning may bring on an attack of wheezing at midnight. So it isn't that one is exposed to the animal and then immediately begins to wheeze. It may take quite a long time before the person begins to react to that. Mold and feathers, mites like carpet mites can be a cause, or tapestry mites of some kind. And smoke. In a household where there is a person with asthma, no smoker should be allowed, and things like wood stoves should be replaced by some other heating device. Now, with the child who is wheezing and uncomfortable with it, sometimes a ride in the car will be helpful to distract the child, and also the little bit of excitement that comes with it opens up the bronchi by means of the excess adrenaline that the child produces, and that can often be very helpful. Clothes should not be stored in the same closet where the child sleeps unless they're stored in plastic. All surfaces should be dusted very frequently. Carpets should be dusted, should be vacuumed thoroughly once a week. And if possible, the person should live in a house that's free from all molds, even free from carpets, since carpets often are a big problem for the person with asthma. Now, recognizing that these problems with the lungs can interfere with breathing and with oxygenation of the blood and oxygenation of the tissues, and therefore in the way that we can think and the way that we can express our personalities. This can help us a great deal to know just how we can treat ourselves so that we can function at our peak. The objective of life is to function at one's peak. And that increases not only our enjoyment, but also our usefulness in the home, in the school, and in the community.